Today we're going to be talking about sciatica, what causes it, where it comes from, and what your chiropractor can do to help. Hi everybody, Dr. Brittany here with Bloomington Wellness Center. Today we're going to be talking a little bit about sciatica, what exactly it is, where it comes from, and what your chiropractor can do to help with some of your symptoms. So your sciatic nerve is a nerve. We have one on each side. It's actually the largest and the longest nerve in your entire body. It originates here in your lower back, and it's a combination of a bunch of different nerves that originate in your lumbar spine and then all merge together to form one big nerve that then runs all the way down the back of our legs and all the way into our toes. A lot of really common symptoms that can arise when that nerve gets irritated are tingling, pain, burning, all the way from the top of the nerve, which can start in your lower back. Sometimes the pain can be in the buttocks area, and sometimes people can also get shooting, stabbing pain, burning, tingling, numbness, all those unpleasant symptoms, all the way down the back of the leg, and sometimes all the way into the toes. There's a couple of different things that can cause sciatica. First off, the most common thing that tends to happen are misalignments in this part of your spine can then put pressure on the nerve. When that happens, again, the nerve gets irritated and then symptoms are felt all the way down the path of that nerve. Sometimes what can happen is that you can have an issue with the disc, and the disc again is a little donut cushion that sits between the vertebra and your spine. Whenever that disc is irritated, whether that's a bulge or a herniation or anything like that, that can poke out and again put pressure on different parts of the nerve that then supply the rest of the sciatic nerve, and again can cause lots of those symptoms going all the way down the path of the nerve. Another less common thing that can sometimes happen that's a little bit tricky to diagnose is that there's a big muscle that sits deep to our glute muscles in our butt. That muscle is called your piriformis muscle. In about a quarter of the population, your sciatic nerve actually runs through that muscle, and in the rest of us it just sits really close to that muscle. So if that muscle is really irritated, it can then put pressure on your sciatic nerve again, causing lots of those unhappy symptoms. What we as chiropractors do initially is just do a really thorough exam to figure out what it is that's causing the pain in that nerve going down the rest of your leg, and then we're going to go ahead and figure out what we can do to correct it. Sometimes that's going to be adjustments in your lower back, meaning just shifting vertebra back into place, which then takes pressure off of the nerve. Sometimes we can do different types of traction and stretching to help with any disc issues that you have in your back to again take pressure off of that nerve. And sometimes it can be different ways to release muscle spasms and trigger points that you have in your lower back and in that piriformis muscle, which again can just help release pressure on that nerve and then take symptoms away from the leg and the lower back. If you have any questions about this at all, please feel free to leave us a comment. And if you like this video, please share with your friends.